Hi, I'm Karen Hamilton, and this is Scott Simpson, and we are the co-leaders for this upcoming 2026 iteration of AHS 3004, Health in Ecuador, History and Environment and Culture. So I'm a public health veterinarian by training, and I'm the Global Programs Coordinator at the Pre-Health Student Resource Center. I've been doing study abroads for about the past 10 years and had the pleasure of running this course in 2025.
And I'm Scott Simpson, and I work in the Pre-Health Student Resource Center as well as advisor. I help students explore and get into different health professions. And I had the chance to go to Ecuador in 2024.
So this is a course that meets most of the spring semester on campus, and then we travel for about 10 days over spring break to Ecuador, and you can see on the map we're going primarily to Quito, Ecuador. It's approved for Global Perspectives, 3 credits. The class meets on Tuesdays from 2:30 to 4:25 p.m., and all of the PHSRC global programs are focused on health in some aspect, and so this one is more particularly focused on Indigenous health. And just to pay attention that the application deadline is December 1st.
And this picture on the left is of Quito as we ride in our um, double-decker bus. It was a great way to um, see the city and get kind of grounded for the first couple days.
You get to taste some awesome traditional foods. So we have locro de papa on the left, a potato soup, and then yapangachos, which are like a fried potato patty with delicious dipping sauces on the right. So a lot of unique traditional foods that you can taste while you're there.
And this was our home base, CMIS. At CMIS is all of the health professionals that we work with during our time in Quito.
This is some of the colonial areas of Quito, so that bus tour that we take the first day or two. There's a colonial church on the left that we tour, and then this beautiful statue on the right that you get to drive up a pretty steep hill to see.
And this was a rose plantation. We had a chance to visit that and learn about uh, the way of life on the plantation and the environmental impact that that industry provides.
We get out of Quito and we go into the mountains, into the Andes. And here's an indigenous community that welcomes us and talks about their practices. So these are some of the kind of structures on ground used for those cultural practices. They also have an indigenous healer and do an indigenous healing process that the students get to participate in. And then on the right here, we have our leaders, Trisha and Scott, dressed up in traditional dance attire
Mhm.
that they talk about what the significance of that is.
And this was a chance to witness a shaman doing healing, indigenous healing practice.
We go to Otavalo at a regional hospital. So this is a public hospital, but it's really unique in that they've integrated indigenous practices, particularly around pregnant women and delivery. So she demonstrates some of the practices that are indigenous practices that she uses with pregnant women throughout their pregnancy and then also for birthing practices.
And this is our time on the equator. You can see two of our students there are trying to balance an egg on a nail. It was a fun time.
And then we wrap up by going and taking a hike in the Cocoa Reserve, and you get to come to this thermal spa and stay overnight here. It's a great time to relax and reflect on the past 10 days before we head back to Minnesota. So we hope you'll come study abroad with us. Our email addresses are up on the screen. Please feel free to reach out if you have any questions. We love doing this. We love seeing you grow and experience during study abroad. So please come with us. Thanks.
Come join us in Quito.